go ahead and pump your fist 10 to 15 times, see if we can get those veins to fill. Here we're going to show another example of a regular tourniquet and then see the difference of veins that we'll see by applying the blood pressure cuff here in a few seconds. I'm still going to go ahead and use the alcohol pad to try to get these veins to show up with a regular tourniquet, and we'll see what we can see as for comparison. Not really seeing too many options. There's a very small vein down here in the hand. We can work on this one here. That's a tiny vein for sure. Not really seeing anything over here. So let's put the blood pressure cuff on and see if we can see a difference. Always want to put the blood pressure cuff high on the arm into the axilla. That'll allow greater visibility on the arm and try to keep that cuff from being too low where you can't see. Try and pump this blood pressure cuff up. The diastolic here a little bit lower. Okay, go ahead and pump your fist a few times. Okay, I'll get another alcohol pad here and see if we can see any difference here. Okay, go ahead and relax your arm. Sometimes it's better to put the blood pressure cuff with the tubing facing upwards. When you have the bedside monitors, it's easy to do that because your display's up on the wall and you can see the numbers. This way, having it this way, I can see the numbers directly in front of me, so that's why it's not. Okay. We're starting to see an outline of a nice vein here in the forearm. I'm not sure if you can see that on the camera, but that's starting to pop up really nice here. You got a whole section right here that you can see the blue vein traveling down this way. And she mentioned before that she is a difficult stick, and clinicians a lot of times have difficulty finding her veins. So we found a real nice one here that we couldn't see with a regular tourniquet. You can also see a vein that popped up down here in the wrist. This is a very tender area for IVs. After you get some experience, these are veins that you can use. You have to be very shallow with those veins before you attempt them. Again, you can kind of see the blue outline here. You can't see so much as well as you can feel, but this is a nice plump vein right here that runs right along this way. And this would be a very good option to start that IV. And this is where you want to feel. I can feel the veins going like this, and actually curves a little bit to the right, so it kind of follows this path right through here. Just knowing, since I can feel the vein right here and it works its way up this way, I would start low, right here where I can see that vein, pulling that skin tight with the C, like making the C with your top and pulling down with your lower thumb here, and that would follow that vein this way. The reason I'm starting low, if for some reason you would miss that IV, you have another opportunity working your way up. Pull this way, keep your thumb, non-dominant thumb, out of the angle so that you can get a shallow angle approach there, and you go right inside that vein.